All right, it's recording.
You are dispatched to a private residence for a patient with an abdominal injury. Upon arrival, you are met by a frantic spouse who leads you to the backyard. Lying next to a tree and a fallen ladder is a middle-aged patient with a tree branch sticking out of his right side. The spouse tells you that she was trimming the tree when she heard a crash and ran outside to find her husband laying on the ground.
Okay, so I'm wearing PPE. Is my scene safe?
Yes.
Okay, so mechanism of injury, one patient, and where did you say that the branch is sticking out of?
The abdomen, the right side.
Okay, so we don't really know if it hit anything super important, so I would say go ahead and call ALS just to be safe. And then we don't really know. I would go ahead and consider C-spine just to be on the safe side. So general impression of the patient is we have a patient or a male laying on the ground. There is a tree sticking out of them. And I assume that they are probably in pain. Probably doesn't feel great. And then responsiveness.
Responsive to verbal stimuli. Answers questions slowly but appropriately.
Okay. And then chief complaint is there is a branch inside of their abdomen sticking out of their abdomen.
The upper right quadrant.
Upper right quadrant. Okay. Airway. Is it patent? Since you said they're speaking. Okay. So it's patent since they're talking to me. So there is no adjunct required. Breathing. How is their breathing adequate?
It seems to be.
Okay. And then how about their SpO2?
96.
Okay. So then, since we're at 96, then I would say that there's no need for any oxygen to be administered or assisted ventilation at this moment. How about are there any injuries that are threatening to the breathing or ventilation?
Nothing noted.
Okay, and then what else? I think did I ask is chest rise and fall equal?
Equal.
Okay, and then so moving on, circulation. What's the pulse?
I can scroll. Was not expecting that. 130.
Pulse is a little high. I feel, and then what about skin?
Cool, pale, and diaphoretic.
Okay. And how about obviously there's probably going to be some bleeding, but is it like pretty excessive? Like I don't know.
Moderate bleeding seen coming from around the branch wound.
Okay, so by the way, since I have to verbalize it, we're going to go ahead and cut around that branch. We're going to get them trauma naked and just kind of check around for any other injuries or bleeding and other wounds. We're going to go ahead and treat for shock. So we're going to want to get them a blanket, keep them warm, and well, try to blanket them with a branch TP. So then we're going to initiate shock management that way. Pulse, skin, what else? I think that's everything. Okay, rapid transport. Baseline vitals. What did you say that the pulse was?
130.
130. Okay. And then pupils.
Pearl.
Okay. And if I listen to, oh, well, under breathing, I also would have listened to lung sounds, but too late. But if I go ahead and do that now, what do my lungs sound like?
Good question, because there's nothing noted.
Okay, well, I'm doing it anyway, listening to lung sounds. How about for blood pressure?
100 over 56.
Okay, that is very low. And then what about for respiration?
26 a minute.
Okay, that's a bit high. And then I think that's it for that. Sample, what about, so signs and symptoms is
Penetrating trauma to the upper right abdomen.
okay. Allergies,
None.
medication.
Blood pressure and aspirin.
Okay, so there's blood pressure issues. Pertinent medical history, there's blood pressure, anything else?
Hypertension and high cholesterol.
Okay, last oral intake.
Breakfast of toast and coffee about an hour ago.
And then events leading up to the
Trimming tree branches.
Okay. And then moving on to the secondary assessment, starting with the head. If I palpate the head, are there any abrasions, contusions, depressions, any?
Injuries noted.
Okay, how about cerebrospinal fluid in the ears, the eyes, nose, mouth?
None noted.
Okay, how about I palpating your scalp? Any tenderness?
None noted.
Okay. Eyes, if I assess the eyes.
Pearl.
Okay, and then the facial area, if I assess that, is everything okay?
Nothing noted.
Okay. And then moving to the neck, is there any tracheal shift?
No.
Okay. Any JVD?
Nope.
Okay, and then how about C-spine?
No obvious deformity.
Okay, and then moving to chest, if I palpate and inspect that, do I notice anything?
Nothing noted.
Okay, obviously being careful of our branch friend. How about if I auscultate the chest?
Lung sounds are clear and equal.
Okay. And then moving on to abdomen and pelvis, do I notice anything?
Tree limb protruding from the upper right abdomen with moderate bleeding, otherwise normal findings.
Okay, branch friend isn't in the chest, it's in the abdomen. Whoops. Okay. And so then how about whenever I assess the pelvis?
Nothing noted.
Okay, and then genitalia?
Nothing noted.
Okay. And then anything else? Okay. How about lower extremities? Anything noted there? Any
Nothing
abrasions, contusions? Okay. And then PMS, is that present?
noted.
It cut out what?
Present.
Okay, thank you. And then upper extremities, is PMS present?
Present.
Okay. And then posterior and lumbar. Do I notice anything? Is there any tenderness or any injuries or contusions, abrasions?
Nothing noted.
Okay. And then how about the butt?
Nothing noted.
Okay. Are there any secondary injuries?
Abrasions to right abdomen.
Okay. So those could be bandaged then. Treat those appropriately. So then we would go ahead and reassess every 5 minutes and continue treating for shock. I would not call off ALS at all. And I think that is everything. So I'm gonna stop recording.